name's Eric Williams. I work at Trinity Hospital. Working in GI lab, endoscopy suites. Been here for 10 years now. I'm a GI technician. I just recently had a close family member who was diagnosed with rectal CA because they had a colonoscopy. And the only reason she had a colonoscopy is because she was having issues. I basically told her that she needed to have one anyway because she was of age. But since she didn't actually go in to have one on her own, she ended up going to have a colonoscopy because she was having symptoms, bleeding and stool. So when she had a colonoscopy, she was diagnosed with rectal CA. She had to have surgery, and she's basically fine now. She's recovering. She's pretty much doing good. Follow-up appointment with the physician. Another follow-up appointment with the physician in a couple of weeks, but she's doing good. But it's very important to have a colonoscopy because you can either live or you can die from it. Basically, you can live or you can die from it. It's very different when it's someone close to you in your family. Even though I see this every single day, it's very different. It hits home when someone is very sick and they go into the hospital.
I'm Dominique West Kimmons, an RN here in Advocate Trinity Hospital GI Lab. I have a personal story to share. My mom was actually 52 now, has been holding off the colonoscopy for 2 years. They recommend you getting a colon screening at 50 years old. Once completed, she did not have colon cancer. She had a normal colon. After 2 years of anxiety and build-up and frustration and hearing different stories, she figured out that the colonoscopy, by having the exam, was not bad at all. She came out with a normal colon. So just my advice to you is put the anxiety aside and go ahead and have the colonoscopy. So we all know that early detection saves lives.
I had a patient, a young African-American male, that came in for his colonoscopy. The reason being, he came in because he had a family history of colon cancer. He was afraid of the procedure, and I instructed him that the procedure is important that he have it because he have a family history, and that's the reason why he had to come in at an early age. He was afraid of the outcome and also of not knowing what to expect. But I pretty much assured him that everything was going to be fine and that we would take excellent care of him.
I run into with a lot of patients is that they believe that the colonoscopy is really very painful. And so what we do to assure them of that is that we just talk to them about the procedure, let them know that we are going to monitor their pain, we'll be administering medication with moderate sedation, and that they're going to be very comfortable throughout the procedure. And lots of times, most of the time, patients leave saying that, oh my gosh, I built it up to be such a big thing, and it wasn't. So that's one of the things that, you know, I like to talk to patients about, just to get them comfortable and to let them know that the procedure isn't all big and bad as they thought that it was.
There's one scenario with this patient. This patient is young, and you can tell the look in his face is so afraid, he's so nervous, and he keep looking around. And then I explained to him everything about what will happen, and in order to ease their tension and then their nervousness, tell them how long you've been working this job because they need assurance.